Hi, I'm Isabel Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about aortic stenosis.
Aortic stenosis occurs when the aortic valve becomes too narrow. Now you got to remember that the aorta allows all the blood to flow out of the heart. It supplies the body with blood. So if the valve that allows the blood flow out of the heart becomes narrowed, it can affect the body in many ways. It can cause shortness of breath, chest pain, passing out, fatigue, inability to exercise. That's one of the main things. But even worse, it can cause sudden death. Now, if the narrowing of the valve is not so severe, then the symptoms tend to be progressive, shortness of breath and the chest pain. And most of the time, this disease occurs in the elderly, but could also occur due to previous diseases like rheumatic fever, which we used to see a lot in the past and don't see so much anymore. This is a serious problem as it gets more progressive, and an echocardiogram helps us measure the size of the valve, how narrow it is, and whether or not you're really getting in trouble or whether this is something you can live with a bit longer.
Awesome. So if I had a loved one who is diagnosed with aortic stenosis, what would be some of the questions you would tell me to ask my doctor?
Okay, you'd have to ask your doctor, how tight is that valve? Is it seriously narrowed, or is it something I have to follow? Remember that this valve stenosis always gets worse if you don't fix it. So, every year it's going to become worse than it was. And another question is, what is my exercise capacity? Because I have limited flow out of my heart, should I walk fast? Should I run? Should I play games? What can I do? Do I need to limit my exercise? Do I worry if I feel like I'm going to pass out? Because that's another symptom. And then lastly, how often should I get this checked with an echocardiogram? Should I do that once a year? Should I do that every 6 months? As the disease progresses, one tends to do an evaluation more frequently. In other words, if you get worse and the symptoms get worse, do an echo right then. Otherwise, as the disease progresses, about every 6 months, do an echo, look at it, make sure that nothing is getting worse quickly.
Thank you so much, doctor, and thank you for watching this video. Be sure to like and subscribe and visit hearthealthcommunity.com to join our aortic stenosis group and to learn more about aortic stenosis.